It's something we've all witnessed, maybe even brushed off. A 10-year-old casually buying cigarettes at the neighborhood shop, or a teen sipping alcohol at a family party. It might seem normal to some, but it's neither legal nor harmless. Each year, more and more Belizean adolescents are being exposed to harmful substances, and alarmingly at younger ages. That early exposure can lead to long-term consequences.
Adolescents have some personal problems, mental issues, emotional problems. Also, at family level, we find that some children, they are being exposed at home to substances. Their parents are drinking, their uncles are drinking. At 10-year-old, they are asking them to drink. So they see it as it's part of life. At community level, there's access. You go to a place, even though they tell you that alcohol should be sold to a child, individual less than 18, but this is not being enforced. They can go anywhere. There's a drug item called the Batman. These small items, alcohol, very cheap. Also in school, we find that people are selling alcohol, they are selling marijuana in school, all those things like that.
Nearly a quarter of Belize's population is made up of adolescents, and substance abuse among them is becoming a serious concern. The problem is that many teens aren't getting help because they're afraid of being judged or mistreated. To change that, healthcare workers are now taking part in a 2-day workshop focused on fighting stigma and making care more youth-friendly. Dr. Melissa Diaz-Musa from the Ministry of Health and Wellness shares what's driving this important effort.
We realized that there was a gap when it comes to services for adolescents. Particularly, there's a gap in, for example, sexual and reproductive health services, mental health services. And we realized that adolescents were not actually coming to our facilities, or even when we go to schools, we did not have the sort of what we needed in terms of the cooperation from adolescents. So we launched an adolescent strategy in health in 2023. And these trainings now form part of that. We're ensuring that the operational plan to this strategy, that we ensure that we start to do our training not only to adolescents and to the general public.
This 2-day workshop is the result of a powerful partnership between the Ministry of Health and Wellness, UNICEF, and the Inter-American Drug Abuse Control Commission, with support from the National Drug Abuse Control Council as the lead facilitator. Right now, about 45% of the people reaching out to NDAC for help are adolescents. According to Director Esner Veos, that's just the tip of the iceberg. Many more teens are out there struggling in silence, still not getting the support they need.
When you look at the consumption patterns, it all depends on the geographical regions, right? In terms of consumption patterns of marijuana, for example, you will see more consumption among the younger population, even adult population, both male and female, in the central region of our country. Yet when you look at alcohol consumption, you would foresee that there is more consumption of alcohol in the northern districts, in the southern districts, and that has to do with our porous borders, contraband, and accessibility to alcohol, particularly among young population.
Training healthcare workers to offer care that's kind, inclusive, and effective is just one piece of the puzzle when it comes to tackling stigma. The Ministry of Health and Wellness says it's just as important to bring a wider public on board, building stronger, united commitment to supporting Belize's youth. Britney Gordon for News 5.